Let's talk a little bit about Obamacare, because Lord knows we haven't talked enough about Obamacare. Your opponent wants the Affordable Care Act repealed.
Yes.
The House has voted a lot of times to do that, unsuccessfully. You support the Affordable Care Act.
Well, this is what I'm for. I'm for Americans having access to health insurance. I just think Americans ought to have access to health insurance, and also ought to have access to affordable health care. So let's think about where we were before the Affordable Care Act. Lord knows there are plenty of things that are wrong with the Affordable Care Act, and we're learning about the things that are wrong. But I totally disagree an approach that says repeal it and let's go back to where we were before. And let's think, Craig, about where we were before. In our state, 1 in 4 Floridians under the age of 65 had no health insurance. We were the second worst state after Texas. People being denied because of pre-existing conditions. Young people not being able to continue to be on their parents' plan, graduating from college and not going into a terrible job market. And one of the worst aspects was this so-called donut hole that seniors were exposed to who were on Medicare. Once you get past a few $1,000s of drug expenditures, all of a sudden you have to pay for everything. I had a woman who did some work for me, administrative work for me, who's on Medicare, and I saw her talk to me about having to take the kitchen knife out and trying to cut her pills in half so she could be able to afford to take her prescription medicine. And I'm sitting there knowing that if she didn't take the full dose, the medicine wasn't going to do any good anyway. So I'm totally opposed to going back to where we were before.
Am I hearing you right, though? Are you saying that you would be open to modifying the Affordable Care Act?
Oh, definitely. There are a lot of things about it that need to be fixed. The first thing, in my mind, is why in the world they said that part of the act is that Medicare can't negotiate with pharmaceutical companies for drug prices. Well, the VA negotiates for drug prices, and they get some pretty good concessions. That in itself represents hundreds of millions of dollars. I also have come across this, there's a provision in there called a medical device tax. We happen to have a number of medical device manufacturers in our area, and many of them are small businesses. And they believe that if this tax is implemented, it obviously will impact their profits, but it will result in job losses. And so many people are supporting the repeal of the medical device tax. And let me just add one more thing that I came across this week. One of our restaurant owners in our district is doing really well because the tourist market is just booming in Pinellas, and they have 45 employees. But they're hesitant to expand because it puts them over the 50-employee kind of arbitrary limit and would throw them into a different category, and that doesn't make sense to me. So those are just 3 examples of things that have got to be fixed about the Affordable Care Act.